Let's continue with the anterior and lateral aspect of thorax and abdomen under location methods and tune measurements. The mid-clavicular line provides a further tool for reference on the upper thorax. It is an imaginary line that runs from the midpoint of the clavicle to the nipple. Since in most cases the nipple lies somewhat more laterally than the clavicular midpoint, the line tends to have a slightly oblique pathway. Stomach 13 to stomach 16 are all located on the line. In men, the nipple is located in the fourth intercostal space, lateral to the midline, while in women, the location can vary depending on the shape of the breast. Stomach 17 is located on the nipple. The mammillary line is an imaginary line for orientation on the mediolateral thorax and abdomen. It runs vertically from the nipple in an inferior direction. The points stomach 18, liver 14, and GB24 are all located on this line. The lower borders of the rib cage unite at the lower sternal border, forming the sternocostal angle. This angle and the umbilicus are the two major anatomical landmarks for point location on the upper abdomen. Caution: it is important not to mistake the sternocostal angle for the tip of the xiphoid process. The latter is attached to the sternum at the sternocostal angle, projecting inferiorly towards the abdomen. For definite identification, palpate along the costal cartilage in a superior direction to where it meets the sternocostal angle. This is the location of REN 16. The axillary line is an imaginary line for orientation on the lateral aspect of the thorax and abdomen. It runs vertically from the middle of the axilla in an inferior direction. Both gallbladder 22 and spleen 21 are located on this line. The free end of the 11th rib can be palpated below the costal cartilage at the transitional zone from the thorax to the abdomen. Location tip: the patient places his flexed elbow at 90-degree angle alongside his thorax. The tip of the olecranon will then usually be close to the free end of the 11th rib. Liver 13 is located below its anterior lower border. By palpating along the iliac crest in an anterior and inferior direction, the anterior superior iliac spine, ACIS, is reached at the lateral end of the inguinal groove. The ACIS is felt as a distinct bony ridge. GB27 is located anterior to it, while GB28 is located slightly more inferiorly and medially. The upper border of the pubic symphysis is an important orientation point for point location on the lower abdomen. The distance between the center of the umbilicus and the upper border of the symphysis can be divided into 5 proportional tune, which can differ significantly from the patient's finger tune. REN2 is located on the anterior midline and on the upper border of the pubic symphysis.